Thank you. Although most days I feel consumed by all that cystinosis has brought our family, tonight I feel joy, I feel hope, and I feel like a difference is being made. 6 years ago, our daughter received a death sentence. Watching her endure one physical battle after another has been a painful experience. After 1 month of grueling tests in a hospital 320 miles away from home, Tina was diagnosed with cystinosis. We were sent home with 33 doses of medications and told our daughter would eventually succumb to a disease that would eventually destroy every organ of her body. There are no words to describe the grief and sorrow that come from being told your child has a terminal illness. At that point in time, the only hope I had was getting through one more day. Medications were given around the clock 24/7. Tina was on a feeding pump day and night. There was all day and all night vomiting. She was too weak to move. She was diagnosed with anorexia, failure to thrive, and rickets. Just keeping up with Tina's massive water intake and constant urination was difficult. Keeping Tina dry at night is still a challenge. We still get up 2 to 3 times nightly to change bedding, as Tina will easily drink 2 gallons of water a day. I remember administering Tina's medications and crying at the same time, because the same medication that was supposed to be helping her was also harming her with its ongoing list of side effects. That was then, this is now. Fast forward to today. After years of hoping and praying, a breakthrough finally came through in the form of a new medication called RP-103, which has replaced the old unpalatable one called Cystagon. Tina got accepted into the FDA trial administered by Rapture Pharmaceuticals in August. She made the weight requirement by 1 ounce. And one challenge after another. That day was one of the happiest days of my life. It did not come with a cost. It did come with a cost, though. Most of winter has been spent traveling back and forth to Stanford Medical from our home in Washington State. Airline travel is difficult with all the medications, excessive thirst, and urination, among other things. It was one of the most difficult things that I've had to experience, with the long days of travel, being away from home, missing half the school year for Tina, and not to mention the rigorous schedules, testing, and blood draws. But it was so worth it. The new medication has freed Tina from a life of vomiting. She no longer takes medications at school, and we have discontinued her stomach meds. The most exciting part is that she is finally sleeping through the night after 6 years. No more 3 a.m. medications. The RP-103 was funded by the Cystinosis Research Foundation. Each of you has made that difference and continues to make a difference in the lives of all these children and adults with cystinosis, as well as other diseases like Nancy mentioned with Huntington's, Batten's, Parkinson's, and fatty liver disease. I joined the CRF board last October, and I'm continually amazed with all that is happening in the way of new treatments and a cure. I know one day Tina will look up to each of you, thankful that you have helped her to fulfill her dream of being a mommy. Although Tina is thriving, the reality is that she is slowly deteriorating with each passing day. She knows she is sick. She has shared with us that she only wants to be like other children. To date, Tina has taken 46,895 syringes of liquid medication and 57,488 pills just to stay alive. Amazingly, Tina rarely, if ever, complains. Recently, Tina had surgery to close her gastrostomy tube site. Her potassium levels got so low they called the code blue and we nearly lost her. These children are so fragile, they linger between life and death. We know that God has something big in store for Tina. Her journey has only just begun. Tina has a multitude of health issues. Our latest challenge is dealing with Tina's eyes. As she grows, the crystals in her eyes change shape and become like shards of glass. The crystals function as a prism reflecting light. This is very painful. She rubs her eyes and feels like they're sanding them. The only treatment available are eye drops that are hard to comply with. They must be administered every waking hour, remain refrigerated, and are not FDA approved. Tina will need to take the eye drops for the rest of her life or she will go blind. The Cystinosis Research Foundation is funding research for new treatments, and this could not come soon enough, but we are very excited. Having a child with a terminal illness brings unimaginable heartache. It hasn't been easy, but your past, present, and future support of cystinosis research gives us hope. It gives us hope that we need to get through just one more day. None of this would be made possible without your commitment and the commitment of the researchers, doctors, and so many others who support the CRF. It wasn't until we came into contact with the Stack family and the Cystinosis Research Foundation that we felt hopeful in this terrible fight to save our daughter. I'll never forget Nancy's words. I will go to my grave, finding a cure for Tina, Natalie, and all those with cystinosis. And believe me, she will. She will find a cure, but she needs our help. Our entire family thanks each of you for letting us have a little piece of heaven every day when we look into this little angel's eyes. We know that one day our wish will come true and Tina will be cured.
Tina has something to say.
Thank you for helping us find the cure.